Welcome, ladies and gentlemen. I've always liked greetings that acknowledge both men and women. It's only proper to address men and women separately, don't you think? Today's tutorial will do just that. More specifically, it will address research on heart attacks that has involved male subjects versus female subjects. This is video 165. It's part of our unit on heart attacks. In the last video, I taught you how different the symptoms of heart attack are in men versus women. They are so different that it's as if they're two completely different diseases. The material for this entire unit on heart attack is in chapter 28 of my book, both the first edition and the second edition. However, in the book, there is nothing specifically about our topic for today. The great thing about having both the book and these video tutorials is that you get all the information from the book, but you get more specific, detailed explanations and demonstrations of everything from these videos. This video is important because so many laypersons and medical professionals are unaware of how research has affected our knowledge of heart attacks in women. So don't take this lightly. Research is a very important part of medicine. Every disease involves research. It's how we learn about who is at highest risk for a disease, the symptoms of a disease, the diagnosis of a disease, the treatment of a disease, and the prognosis of a disease. Without research, you'd be left with people's own personal stories about their diseases, testimonials about cures, and all sorts of inaccurate information about diseases. Research gives us concrete facts. It provides statistics. And one of the reasons research provides these things is because research studies are designed to take everything into account. They account for differences in cultural groups, age, socioeconomic status, lifestyle, etc. But even though research studies try to account for everything, they are not perfect. Sometimes research studies are unable to account for everything. Sometimes they just fail to account for something. So today I'm going to present the state of affairs with regard to research on heart attacks in men versus women. In the previous tutorials on heart attack, I've taught you that women focus more on breast cancer than they do on heart attack, that both fat and sugar cause heart attacks, and that the symptoms of heart attack in men and women are completely different. Now, I'm going to explain how research impacts women's perceptions about heart attacks, women's awareness of the symptoms of heart attack, and women's treatment of heart attacks. First, I'll tell you about the history of research on heart attacks, and then I'll tell you the effect it's had on heart attacks in women. Since way back in the olden days, most medical research has been conducted on men. Why? Well, because it was often done on volunteers from prison or the military, the vast majority of whom were men. In these instances, it was simply easier to use these readily available, willing, and able subjects. In other instances, researchers preferred men because of fear that menstrual hormonal changes would affect the results. And it is true that women's menstrual cycles interfere with certain study parameters. One of the most basic tenets of research is to control as many factors as possible so that you can study the matters in question. The more uncontrollable factors there are, the less valid the research findings. So, avoiding women's menstrual cycles proves beneficial in terms of research quality. And in other situations, researchers preferred men to avoid inadvertently including a pregnant woman in the study. You know, pregnancy can confound just about anything. And when you take into account that research costs money and that most research is funded by companies or foundations, you can't afford to sabotage the study by including study subjects that might invalidate the data and thus forfeit the funding. So there have been many reasons that most medical research has used men as study subjects instead of women. And for the most part, the results of studies using men is typically generalizable to women. With most diseases, men and women are more similar than dissimilar. And in most instances, research data using male subjects benefits women greatly. But not in the case of heart attacks. Now, add to that the fact that men tend to have heart attacks at younger ages than women. And before women started living long enough to reach the age of menopause, it was really rare for a woman to have a heart attack. But then, women began to routinely live well past the age of menopause, and bam! They began to have heart attacks as frequently as men. But heart attack research on women is still relatively new. And now we have a terrible situation in which not only are women routinely having heart attacks, they also don't know that they are at high risk for heart attacks, nor do they know how to recognize a heart attack. So here are some of the consequences of heart attack research on men instead of on women. Have you ever heard the term widowmaker? That's one of the ways in which people refer to heart attacks. When you hear widowmaker, what comes to mind? You automatically think it's a disease that occurs only in men. But heart attacks don't occur only in men. So the first problem is perception. Women don't perceive heart attacks as a threat to themselves. Most women are shocked to discover that heart attack is their greatest risk at menopause. 70% of women report that their healthcare provider has never discussed heart attack with them. In fact, the vast majority of women get information about heart attack from sources other than their physicians. They cite magazines, television, newspaper as common sources of information. But these sources are not credible. And unfortunately, neither are a lot of physicians. That's right, physicians also have a distorted perception of heart attacks in women. It's really shocking how long it takes people to catch up with reality. Because heart attacks were historically more frequent in men, and heart attack research involved men. And so now a large portion of the medical profession still isn't on top of the fact that heart attacks are common in women. As a result, they don't inform their female patients about the risk of heart attack, and they don't discuss dietary measures that can reduce your risk of heart attack. And they don't perform screening tests for blocked arteries that can lead to a heart attack. Many of these misperceptions exist because of the knowledge that estrogen protects women from heart attacks, and it does, until you lose it at menopause, and that's a game changer. And believe it or not, many medical professionals don't even recognize the symptoms of a heart attack. It is not at all uncommon for a woman experiencing a heart attack to go to an emergency department with symptoms that are very different than those of a man, but to be misdiagnosed as having something much less severe than a heart attack. And this results in fewer definitive studies to document a heart attack, less use of lipid-lowering medications, and less aggressive treatment. Many healthcare professionals rationalize their tendency to treat women less aggressively because the clinical research utilized to develop the guidelines for heart attack prevention involve very few or no women. They view this as inadequate gender-specific proof of benefit. Others apply preventive measures that are appropriate for men but not for women. Now, all of these oversights culminate in a higher mortality rate for women after a heart attack. One of the many reasons I make these videos for you is that there are so many problems with medical care for women. My goal is to educate you so that you can recognize the things that are risks for you. If you suspect that you're having a heart attack, make your medical professionals prove to you that you're not. Do not let them send you away with a label like indigestion or anxiety. In the last video, I taught you how incredibly different the symptoms of heart attack are in men versus women. So if you experience any of the symptoms in that long list of symptoms for women, be sure you get a complete evaluation that completely rules out a heart attack. The bottom line is that most people, including medical professionals, are still not aware of the symptoms of heart attack in women. This is largely because most of the research on heart attacks has been done on men. So to compensate for that, you have to know the symptoms, and you have to demand a full evaluation to rule out heart attack if you suspect that you're having one or going to have one. The disparity between the genders affects every aspect of heart attacks in females. As a result of heart attack research primarily on men, women do not receive the same level of care as men with regard to recognition of the symptoms, prevention, screening, diagnostic tests, lipid-lowering medications, surgery, or rehabilitation. As a result of heart attack research primarily on men, women have a higher fatality rate from heart attacks than men. So this video will help you compensate for these flaws and save your own life. That's where I'll stop today. Be sure you're watching these videos in order because it will make everything so easy and logical for you. Schedule a one-on-one consultation at menopausetailor.me if you need me to help you with anything. And please follow me on Facebook, Twitter, and Instagram. Subscribe, and come back in a week when I'll discuss your family history with regard to your risk of heart attack. Bye!